Hi, I'm Dr. Ivor Benjamin, Conference Co-Chair of the AHA-ACC Consensus Conference on Professionalism and Ethics, a consensus conference report.
I'm a past president of the American Heart Association. I'm also the director of the Cardiovascular Center at the Medical College of Wisconsin.
I'm joined today by Dr. Emelia Benjamin, who was a lead author of this paper and specific task force on diversity, equity, inclusion, and belonging. Dr. Benjamin is professor of medicine and epidemiology at Boston University Schools of Medicine and Public Health.
This is a very painful topic to bring up because none of us want to think that this happens. We have to take on abuses of power, sexual harassment, overt racial bias. We have to embrace that. We have to regard that with the same seriousness as we regard academic and scientific misconduct. We've got to have robust systems for destigmatizing reporting of harassment and racism. We need to have independent investigations. We need to hold our colleagues accountable, and then we need to disseminate summaries of actions and providing visible support to targets. Now, I want to be clear. I'm not talking about every time somebody says an insensitive comment, we're going to cancel them. I don't know many people who haven't said insensitive things. I personally have said insensitive things. I think that we need to have restorative justice. We need to have bystander training. We need to have effective allyship so that we can call our colleagues in to be their best selves, so that we can help people understand that their intentions may have been good, but their impact was not. This is probably the most important and probably central to what AHA does best, which is the American Heart Association is so deeply committed to science and evidence-based clinical care and research. So we need to similarly invest the same amount of energy, funding, and rigor into conducting and publishing the evaluation of programs and interventions to address bias, harassment, sexism, racism, and the converse, what are cultures that are creating cultures of diversity, equity, inclusion, and belonging? I think through the robust science, we can start to disseminate these across practices, across institutions, and we can see the kind of acceleration of cardiovascular health equity that we all want to see.